So what I'm hearing, Dr. Esmaili, is there's a homeostasis problem, epidemic, there's a sleeping epidemic, and there's a breathing epidemic.
Yes.
What's the main problem here?
The main problem is that the environments that our children are growing and the industry that is supplying the food to our growing children from birth is predisposing them for genetic predisposition, or I should say, change upon the genetic that makes them not adaptable for growth that they have the potential to grow into. So our children are basically eating food that does not give them an opportunity to grow their jaws and their faces in the growth phase. They are not using their muscles in their face because there's no demand for it. And as a very young age, they pick up habits like mouth breathing instead of how they should be breathing through their nose. And lack of breathing is causing this medical conditions that I want to explain.
Okay, so this is a personal topic to me. I have a son, his name is Luke, and he had snoring issues and breathing out of the mouth issues when he was a young boy. It was crazy. He was a snoring son. He was a snoring boy at night. And my wife and I would look at him sleeping. We're like, is that okay? Is that not okay? We didn't know. For whatever reason, we mentioned it to our dentist, and he kind of led us down the path that this might be a problem. He can't take care of it, but he knew of someone like you out in California that could. And it led us down a whole rabbit hole to where or rabbit trail until we got it fixed. I still don't understand what the problem was. He was breathing out of his mouth. He was snoring at night. Why is that a problem?
The problem with that is, Matthew, the children, if their tongue is not trained from birth to go to the roof of the mouth, because roof of the mouth, think of it as a bubble. And this bubble can only grow if the tongue exerts pressure on it from the bottom, from the first floor, and think of the nose as the second floor. And air being going through the nostrils in through nasal breathing and tongue pressure are the two factors that grow the palate in the right direction, this way, outwards, which will guide all the soft tissue and the tongue and everything outward this direction. Now, what happens if tongue is not trained to go to the roof of the mouth? Well, everything stays in the airway and keeps it narrow. And that narrow airway that collapses produces those vibrating noise, the snoring. Now, you might ask, why would the tongue not go to the roof of the mouth?
Or what did I do wrong? Why did it?
Yes, that guilt trip. Believe me, as a mother, my daughter went through the same thing. I asked that question so many times. What did I do wrong?
What did I do wrong? I don't know what I did.
So the fact is, there's multitude of reasons. This is not a one single isolated problem with our children. We know a lot of kids are born with this condition called tongue tie. Now, for those people that don't understand what that is, if you're looking underneath the tongue, there's this white rope that attached the tongue to the floor of the mouth. That is by design. Tongue is one of the biggest muscles in our body that has 5 of our 12 cranial nerves attached to it. Now, if tongue attachment to the floor of the mouth, think of it like the fingers. During the embryology development, if the fingers didn't separate, we wouldn't have 2 fingers like that. So if your kid was born with 2 fingers that are attached to each other like this, you would be concerned about it.
Yes, I would be.
Yes, you'd be like, separate this too. We want 2 fingers. I want to count all the 10 toes and 10 fingers. We all do that with our kids. Mm-hmm. But when the tongue is tied to the floor of the mouth, and this is where the areas, the early sirens that does not get noticed is pediatrician, lactation consultants, nurse practitioners should look underneath the tongue. A child that does not latch for nursing, painful nursing, because the kid cannot completely latch and swallow correctly, is because of that condition. Now, we don't quite know, and we have studies going on that determines what is the reason why we have more of the children's tongue being too attached. And there could be a mild condition, it could be a moderate condition. If the attachment goes all the way to the tip of the tongue and we're looking in there and the kid's tongue doesn't even lift up, that is a pretty severe condition. That tongue will never go and do the job that it was designed to do. And the kid cannot nurse. One of the things that grows the airway and get the child a chance to swallow correctly is tongue pressure at the roof of the mouth. And why breastfeeding is important, it forces the kid to force the muscles in the face to get the milk out of the breast tissue, and also the force of the breast tissue on the face that pulls the face forward. That whole mechanics is enabling all that growth to happen. Now imagine, again, it could be a genetic predisposition, a malnourishment during the genetic or the gestation that prevents the tongue separation. So the tongue is attached. It's like cleft palate. Think of it that way. Very easy condition to fix if it's recognized. It's a laser procedure and 2 weeks of follow-up, and the kid can latch and go back to normal function. Now, that's one of the biggest reasons why children don't develop the correct habits. And the other one is allergens. Milk allergy is a big one. So our kids, if you refer to what I was saying earlier, the food that kids are getting and all are getting exposed from environments, from our food, it cause inflammation in the child's body, what they cannot process. Their body has a lot of immune cells that can develop inflammatory responses to that. And the inflammatory responses block the nose, because nose is filled with erectile tissue that responds to inflammation, and it swells. And when the nose swells up, then you can breathe through your nose, and body's
and you open your mouth up.
Exactly. That's a second route of breathing. So what can we do if we can't breathe through our nose? Automatically, the mouth props open. So these children develop this habit of mouth breathing because of the potential allergens in their food, environment, pets. Again, when I said a multidirectional culprit, I meant it's not just one thing. It's multiple. And these kids usually have sinusitis, a lot of breathing disorders growing up. Hay fever is a big one, because if you are not using the God-given apparatus to get the air from the tip of the nose to the lung, and you're using the substitute, which is the mouth, it is a disease. Mouth breathing is a disease. Should not be the route of getting oxygen to our body. It is a secondary, a backup apparatus.
So the problem here is, if you have a child, so we're talking to parents, if you have a child and he's breathing out of his mouth when he's sleeping, that's a problem, and we need to look at that. So that's a big sign, right?
Absolutely.
So whoever's watching this right now, if you're a parent and you've got a child and he or she snores at night or breathes out of his mouth, we have an issue, and it could be one of several things, and that's what we're discussing here today. Sounds like we could go talk about many things.
Yes.
That's the big thing right now.
Big one, mouth breathing. And
what's going to happen if we don't fix that, or if we don't address that? What's going to happen to the child?
In many things. I mean, one of the biggest reasons why mouth breathing has been a big topic, especially lately, is that if you think about it, the defense system that our bodies are designed for protecting us against the bacteria and allergens in the environment, the nose. I'm going to get back to the nose, and it will kind of lead us to why mouth breathing is not the right route. Nose is equipped with linings that are moist, and it can capture the allergens and the bacteria. And also, when we're directing the air through the nose, there's this areas that look like nooks and crannies called turbinates inside the nose. If you're looking at the X-ray, they look like mazes inside the nose. There's a purpose for that. That process slow down the air getting into the nose, and during that slowing process, the air gets moist, heated, and bacteria is removed, and the nitric oxide, which is a wonderful gas in our paranasal sinuses, maxillary sinuses, frontal sinuses, and other sinuses that are air-filled spaces around the nose, they pull nitric oxide into the air before it gets to the lung. Now, the amount of medical benefits to nitric oxide, the biggest one is it actually cleans the air. It stops the proliferation of the viruses, especially the big one, COVID right now. Nitric oxide, we have studies that it will stop the proliferation of the virus before it enters the lung. So that's a huge one.
Now, I hate to interrupt you, and this all sounds great, and this is great scientific evidence, but I don't understand what you're saying.
Okay.
Why do I have to address this, and why do we have to fix this in our children? And is it happening more?
It is, because Matthew, the whole process of cleaning the air and removing as much allergen from the air before getting to the lung,
right.
Here's why it's important. Because if mouth is doing the job and not the nose, all of those benefits I listed, we will not going to get. And
Got
all
it.
these bacteria and allergens will go straightly to the palatine tonsils, which is those big tonsils right behind the tongue.
Got it.
And as they respond and they get bigger, they will cause this airway or passage of air to the lung even narrower. And that's one of the reasons most of the kids snore, because their airway become tinier and tinier and tinier, because these tonsils get bigger and bigger and bigger in response to their mouth breathing. So is it important to get that habit corrected early on, finding out what's causing it? Absolutely. Because if we wait too long and the tonsils are in a grade 4, and let me give you an example of what a grade 4 tonsil is. If you're looking at the back of the throat and those circles are halfway through or a quarter way through the airway, that's grade 2. If they're halfway through, they're a grade 3. And if they're kissing, it's a grade 4. You could imagine how difficult it is to get through those. And that's one of the reasons why the ENTs recommend removing them in children that have airway issues and sleeping issues, because they know that's obstructing the airway. But we also know if you're not addressing the cause, what made them enlarge, which was mouth breathing to begin with, we've seen the cases where the tonsils become enlarged again. And that happened to my daughter. We had adenoids and tonsils removed, and adenoids came back because the habit was never corrected.
Maybe that's why you're so passionate about this subject.
Absolutely. And Matthew, it's not just the snoring that is, and it's not the static social issue anymore. We know it's a complete severe medical condition, especially in children, because, and I would love to expand to a couple of areas. Why is it even important? Okay. Aside from adenoids getting enlarged, aside from, it's not a correct route to get the air through the system, that promotes the tongue posture to stay low. Because if mouth is the primary way to get air through the system, then tongue has to stay low to make that happen. So mouth, in that case, think about it. It's something that we can actually simulate. If you were to have your mouth open and breathe, that would position the jaw in a lower position. And that gets into the airway. So head cannot stay in a correct postural position. So automatically your head gets forward positioned to accommodate mouth becoming a route of air going through the system. Now, that's going to start a positional problem for the head, as you can imagine, because our head weighs about 12 pounds. I think that's a mature child at teenage. It's about 12 pounds. But think about it. If you have a bowling ball that's 12 pounds and you hold it in an uncomfortable position with your hand, think of the things that can happen to your arm and the muscle and the joints that had to accommodate that. And every 15 degrees that our head is in a forward position, it adds 10 to 15 pounds to the vertebrae that have to support it. So you could see this is now becoming a systemic issue, not just a breathing issue. And we're looking into.
So we have to get this message to the young parents who are having children now.
Yes.
But there is so much on the plate of young parents with young children. I mean, how are they even going to find out about it? And why would this even come on their radar? And how do we get it on their radar? I mean, this subject is complex and important.
It is complex.
It's a tough sell, doctor. It's a tough sell.
It is a tough sell, but you know what? As a parent, I lived it.
Yeah.
So I'm going to switch hats from doctor to mother. I wish I'd known this when my daughter was 6 months old. And
right.
I was concerned about the snoring, and she would fall asleep in the car every time. She would snore and she would wake up with nightmares. And that's what happened to those little kids when they're not sleeping through the night. And here's what happens in a good deep night's sleep in children. Their bodies restore homeostasis. That's a big word, which means they're producing growth hormones, which is important. Their bodies restore its function the way it should be, and their growth is restored. That means they need to be completely paralyzed in deep stage of sleep. No movement. That's what should happen. Think of it like this. If I have a crew coming to clean my office and at night, and every 5 to 10 minutes, the fire alarms go on. Every 5 minutes, I have to evacuate, and they come back and clean a little bit, and they have to evacuate again. Yeah, my office is not going to look clean in the morning. Think of the body's homeostasis as that cleaning crew. They come in at night, They get rid of the toxins in the body, which some of them attack our, our nervous system. And in a child that's nervous system is growing, it is that much more important that they take those deep stage sleep. It is uninterrupted because their growth and their development and their brain function all depends on it.
Now you're speaking my language, right?
There you go. Yes. And one of the things that happen in children is their emotional center and the part of their brain that controls their behavior is forming.
Right.
So whatever hormone that their body is producing, they respond to it very quickly. So when their sleep is disrupted because their tongue is stopping the airflow and their brain detects that, yes, there's not oxygen going in, they're constantly in a fight for their life because the body's fight or flight response, it works in the same exact way that it did in our ancestors. It responds one way. You're either being preyed upon or you're dying or you're starving. It will do exact same thing. It will wake you up. It will put you into stress mode, and cortisols and all those messengers are produced so that you then will save your life. Well, you're not necessarily being chased upon by a bear or tiger. It's just your tongue is occluding your airway. But their body does exactly the same exact response as if you were. So they're constantly, every hour, however many times, they're going through that process of fight for your life or flight instead of digest and rest and restore homeostasis, right? The cleaning crew, they're trying to clean and they're being chased out of the room. So one of the side effects of that is now this kid has all this stress hormone running into their little system. And remember, they're brand new, okay? Their body's trying to figure it out. So they have this bad hormones for stress released into their system, and their bodies respond to that is fight for your life. And I think of it this way. We're not empathetic when we're in a fight or flight. We're just designed to fight for our life. So our systems respond to fight or flight is no empathy. These kids usually have those mixed behavioral issues like hitting other children, having temper tantrum, ADHD symptoms, because their little brains never get a chance to either restore itself, develop correctly, all the growth hormones, all those homeostasis I was telling you about is halted until the breathing is corrected.
Sleep. They need their sleep.
So important. Sleep is medicine.
And if they're not breathing properly, they're not going to get their sleep.
Exactly. And disruption in their sleep because of breathing disorder will basically change their physiology. In essence, they have all these growth hormones. And what I've noticed now, that I don't know if there's any scientific evidence with that, children that engage in martial art activities or any sports, they usually recycle those stress hormones. So they're not usually showing much of those signs. Kids that are not as active, they're staying vigilant during the day. They have a hard time staying still. Again, ADHD symptoms that they exert. And a lot of times they get misdiagnosed and put on medication. And we're looking at them as if, and they are getting overdiagnosed and being put on medication, which, by the way, centrally acting medications that are prescribed for ADHD wrongfully can, in fact, disrupt your sleep even more. Do you see now the cycle we're creating? Instead of solving the problem, we're adding to it. We're just sedating the child into behaving the little kids they are while they're awake, but they go to sleep and they're still not sleeping well. Another one that is attached to this condition, if for those parents listening, is bedwetting. It's a huge one. And you might wonder, well, what is the relationship between the two?
Bedwetting.
Yes, especially kids that should be potty trained at age 6 or 7. And sometimes I've heard in older children that they're still wetting their bed. They can't go for...
Now this is interesting. Why bedwetting?
Yeah, well, remember, I'm going to go back to my little lecture, and I try not to be super technical about it. But remember the Restore Digest cleaning crew, right?
Yes.
The cleaning crew that come in to restore the homeostasis, clean everything. The rest and digest, one of the things that it's controlled by one giant nerve in our body called vagus nerve. Now, I'm not talking about Las Vegas. I'm talking about the big giant cranial nerve number 12 that controls the entire Restore Digest system, our guts, digestive tract, and everything that is happening when you're not in a fight or flight mode. So one of the things that is controlled by is the urination system, right? So all of those functions that would be controlled in the rest or digest is affected when you're in a fight or flight. And our bodies actually produce a hormone that would stop us from urinating excessively at night. Basically shuts down the functionality of the kidneys, or not shut down, but reduce the functionality so that we don't get up and go to the bathroom. Technically, we should not be getting up. Humans are created in a way that we should be going to bed. Melatonin gets produced. Our bodies start to think, brains are geared into going to sleep, which is why I should not be sitting in front of the blue screens and TVs and whatnot.
It's a whole other conversation.
Yes, right? So when the melatonin gets kicked in, all the other systems kick in, you're ready for bed, so that your body kind of starts kind of winding down in terms of doing all the other functions. One of the functions that kind of winds down is urination. Well, what happens is when we're in, again, fight or flight, I keep going back to that. When the sirens keep going on, one of the things that is halted is that urination process. So body's attention to all these other symptoms is stopped. Again, we have found that majority of the children that have bedwetting habits is because they're constantly waking out of the deep stage of sleep and their homeostasis is not restored. So that hormone is not produced in their system.
So I've got a couple questions here that I really want to get answered.
Sure.
And the urinating, bedwetting at night answered one of them. So this is a great segue. How do I identify that this issue even exists in our children? How do you even identify it? What are the signs? Sounds like there's a lot.
There's a lot. And
so lay it on us.
What we're thinking of our kids are not little people. I mean, I just want to be clear about that. They're not just little humans. Their system is completely different. They're growing and they're developing. And anything that disrupts that natural and the way that they were designed to grow and they were supposed to grow, anything that disrupted, they go into compensation. That's how body works.
What does that mean?
That means, let me give you an example that people can relate to. Think of it this way. If you step on a nail and you hurt your one foot, what does your body do? It goes, okay, I'm going to avoid walking on that foot for now. I'm going to shift everything to the other foot. So you can keep on going through life, avoiding that. Now your body is still propelling to avoid the pain on that side, but using the other side, right?
By overcompensating.
Absolutely. What happens if you're overusing the other side of the body?
It gets stronger. It gets more tired.
Tired and symptoms. If you're constantly using one side of your body, that side starts aching. What do? We go into the doctor and say, this side hurts. What do? We get in symptom treatments for that side, not the side that caused the problem. That's what I was referring by compensating and changing course so we keep going through life. When little people, our little babies, start compensating from a young age, when those little tiny sirens are missed, and the body goes into compensation mode, something will give. And that something that gives becomes the problem as they grow up. When the nose is blocked because they have a milk allergy, they mouth breathe. When they're mouth breathing, they start getting enlarged tonsils. When their tonsils get bigger, they become snorers, disrupted sleep. When they have a disrupted sleep, their homeostasis is halted. Now they have behavioral issues. Now they have growth problems. They're not growing. They have dark circles around their eyes. Their mouth is propped open because they're not using their nose. They're eating with their mouth and breathing with their mouth. Another big one is, what happens if the kids are not using their tongue correctly and their mouth breathing? The tongue is what forms their mouth. And the way they're chewing, all the muscles in their face, the tonicity of their face.
Their mouth.
Absolutely. Yeah. Their face is growing. Again, they're not little people, they're growing. So what moves the growth of their face is all those muscles that basically now, because of their mouth breathing, are underutilized. So they're not helping the mouth and the jaws to grow. So they're growing smaller faces and smaller mouth and smaller airway. Because remember, palate is roof of the mouth, floor of the nose.
Okay. So if my child is getting smaller face and smaller mouth, they're going to get physical abnormalities as they grow into adults, possibly?
Absolutely. And let me tell you, one of the big one is...
I've got an issue with that as a parent, right? I need to fix this. I need to identify this. I don't want this to happen to my kid.
As a parent, I think every parent should want their kid to have every opportunity to grow and to flourish and not need medical system. That's my goal for my kids. I wish for my kids to never get sick, to never need to go through surgeries. And, one of the things that begs the question is, Why do our children have so much crooked teeth and crowded teeth as they're growing? Look at the kid's mouth. Because it's becoming a norm, we don't ask the question anymore. Just because something is common doesn't mean it's correct. That's my thing. When we're looking at children around us and all of them have crooked teeth because they're all suffering from the same, remember, epidemic, we don't question, are these kids normal? When we see dark circles around the eye, long faces, mouth that's always open, chewing with their mouth open, noisy eating, noisy breathing. If we see all the kids with the same problem, we don't ask the question, well, just my kid is as bad as your kid, so therefore it's normal. It's not normal. It's common, but not normal.
Right.
And we're removing wisdom teeth on almost 90% of our kids. The last 200 years, we've been removing teeth. Let me tell you what, if we start removing pinky toes or the fingers on all the 90% of population, because our bodies did not grow enough to make this finger functional. If for 200 years, with the medical condition system, we'd be asking the question, why are we removing this finger on all of our kids? We would ask the question because your body did not develop enough to make use of it. Well, wisdom teeth are the same way. Our jaws are not growing enough to make those come in like a natural teeth because they stay small because they're not using their face muscles to grow them. From the breathing standpoint, the chewing standpoint, their faces are weak and small. So therefore the wisdom teeth get impacted and we have to get them out.
So this is the root cause is maybe coming from food and eating, or
it's a combination of things. And then if I were to, I'm going to go back.
Sounds like this is a whole other subject.
It is a very all-encompassing, Matthew, and at the same time, it's one of those subjects that I think when you look at it from a drone field of view, it's almost like everything goes back to one thing: breathing.
Really?
Absolutely. Breathing is probably, we as humans, I mean, this is one time when we know, and I'm going to cite Dr. Her name is not coming to my name fast enough. She was an orthodontist from Ukraine that kind of went through human skulls of many, many years ago, 200 years ago. Morton collection that was mentioned in the book Breath by Dr. James Nestor. Parents out there, please read this book. It's one of the best reads.
What's it called?
A book called Breath.
Breath
By Dr. James Nestor. Bestseller book. If you get the audio version, have it in the background in your car, listen to this book. It is amazing. This gentleman who wrote the book went through the whole experience himself of plugging his nose for 10 days, completely mouth breathing, and documented through Stanford research how his life declined.
Okay.
Just by changing his breathing completely from nose to completely mouth. Okay. And then after they removed the silicone plugs from the nose, went through series of breathing exercises where he created that correct breathing and hunger for CO2 and breathing exercises, how his health was restored and then some. Mm-hmm. Amazing book. And he talks about all these breathing exercises. But if I were to go back, it was Dr. Mariana Evans that looked into the Morton collection mentioned in this book. And she looked into the skulls of this ancient humans. We're talking 200-300 years ago. And if this was really genetic, because a lot of parents say, oh, I have smaller jaw, so my kid should have a smaller jaw. It's genetic. Because we don't know something, it's either genetic or nervous system. And no, it's not. Because for genetic to alter the way we know it, it takes thousands of years. Thousands. And we have looked into the human skulls of 300 years ago. They have giants, massive jaws, big nostrils. That was meant for getting air through the system. Big giant nostrils. And that's what Dr. Mariana Evans was looking at this skull collection and the Morton collection. And she mentioned the jaws of this skulls did not need an oral surgeon to remove their wisdom teeth. They did not, no access to orthodontists, and they had straight teeth. They had all beautiful teeth in their arch.
But I'm not connecting the dots. I'm not understanding.
So what really grows the bone? Form follows function. If you don't use it, you will lose it, right?
Right.
Remember the children I was referring to in the growth age? What makes their bone grow is function. Think of what we're eating and what these people were eating 200 years ago that share the same genetic pool, almost close to the same genetic pool as us, not 2,000 years older, same genetic. They had hard food. They were chewing on real carrots and meat for hours. We're talking Irish oatmeal compared to cereal. What do our children eat? Food that melts in the mouth.
Delicious.
Kept them, right. Everything comes out of a tube in a form
Yes.
of a paste.
Easy.
They just melt in their mouth.
Right.
Cereals, right? Mac and cheese.
Yep.
Any of those require any chewing function? You could literally put it in your tongue and swallow it, right? Why would the bone grow if there's no pressure on it? It won't. So if you're not chewing, and the kids are not.
Okay. Like a muscle in a gym.
Exactly. How would we grow? Exactly. And muscles in the face are what growing the jaw and grow it out in the direction it should grow. And along with that, all the airway bone shares the real estate with the mouth. Think about the palate. If the palate grows completely because of the correct pressure and the tongue pressure and all the good functions, yes, the airway can grow. But what happens if we're not giving our children food that force them to grow? That basically their muscles are not going to be active and they're not going to have as much activity to grow the bone, and their jaws is small, tiny. And tiny mouth syndrome, or shrinking face, I should call it, is our epidemic. And we are basically bestowing that on our children unknowingly. As a parent, if I'd known, right, and we're told, just introducing the children to softer foods in grade 1 and grade 2. And I think every 6-month-old child should be just gumming that carrot, put them in a little pouch so that they don't choke on it, and give them hard food. Let them just gum those jerkies, organic without the phosphates. But
so this whole thing is coming because of the food that we're eating at a young age.
Absolutely. Absence of hard food, real chewing function in our children's life is leading into them not growing their jaw.
So baby food, Gerber.
Get them out of the way. There's nothing worse that we have created for our children than food that melts in the mouth. Nothing should melt in the mouth of a child. The mouth of a child should work. And if they're not, fix it.
Okay.
If they have a tongue that is attached to the floor of the mouth, release it early. The kids bounce like that. I mean, infants that is 2 weeks old, they will learn how to latch and use their tongue.
Those are two different things. Like the tongue tie is happening a lot. You have to be aware of that. But
yes.
But the soft foods, that's an issue. You have to be aware of that. These are two separate things. Okay.
Well, in essence, I think they have a common denominator, because think of tongue is one of the biggest muscles in our head. I mean, think of it. This giant muscle, it's connected to right here. By the way, that's the base of all the muscles that are to the tongue right here. So if a tongue, and for lack of a better term, if a tongue is lazy, tongue tie, lazy, it does not lift up and do what it's supposed to do. It orchestrates.
So maybe it is a little bit connected.
Oh, it is a connection. And here's how I'm going to show it to you. Okay. So internally, the tongue pressure opposes muscles in the face. Think of a child that's swallowing. That's one of the big functions that our kids are lacking, is correct swallowing. For correct swallowing to shape the bone, tongue needs to completely seal the palate. And from tip of the tongue to the body of the tongue covering the palate, kids should not be using their lips, their cheeks, or their chin for swallowing. It should be completely passive activity. That internal pressure of the tongue when swallowing, which we do it about 2,500 times a day, will be opposing those other muscles, right? What happens if tongue does not do that? When the internal pressure of the tongue is weak because of soft food, because of low tongue posture, because of mouth breathing, because of tongue tightness, now we have to use external muscles, compensate, remember that word I said, compensation, to swallow. What do? They use a reverse swallow. They use their chin, lips, and every time I want to see if a kid has a bad habit, I just hold their cheek back. Parents do it out there and you're going to be amazed. Hold their little lips and cheek back and have them swallow. And then you would see their tongue is trying to push against their teeth. They're struggling because those are the muscles they use for swallowing, and they shouldn't. So why is tongue posture and tongue use important? Because if tongue is not doing what it's supposed to do in swallowing and breathing functions, everything else has to compensate, and they mold the face, basically. Cheek muscles will mold the upper arch into this tiny little arch, right? And instead of growing out and shallow, it will have a high ceiling room has a high ceiling right there. Now we have a bigger challenge. tiny mouth syndrome. A tiny mouth syndrome that was caused by a tongue that did not do. Like I said, I'm trying to simplify this, but think of it as a
This is
domino
the
effect.
epidemic here. Tiny mouth syndrome
It
epidemic.
is an epidemic, and that is a subject that I think I can slice and dice, but I have to tell you, when I look at the whole picture and I'm thinking, if I had one start of a domino effect, that would basically cause everything that I just talked about. Where did the domino effect start?
I'm dying to know.
I can give it to you. I'm going to give it to you right now. Breathing.
Drum roll.
Breathing. It's the breathing. If the kids are not using their nose.
But why are they not using the nose? And is that my fault as the parent?
It is not your fault. But again, if you're looking at our children, and it's one of those things, Matthew, that it's like a triple fold problem. We're thinking of children that are constantly clogged in their nose. One of the biggest one is, again, allergens in the food, bacteria in their gut. And that's a huge study we're doing. What is the bacteria? Because children, when they're born with a C-section, they don't go through the birth canal, right?
Yeah.
That's a predisposition to a big health problem, because kids don't have their own bacteria. As soon as they go through the birth canal, they're going to get those from mom. That's why if they have, infections in their body, we want to resolve it, because the kid has no immunity of their own. They're going to contract that. So kids born with mycobacterium from a vaginal birth versus a cesarean section will have different gut bacteria, right? Now think about it this way. Everything from the environment, from the milk, anything that mom eats, right, in the kid's body, when they can't digest it, it becomes an inflammatory signal to their body. And when there's inflammation, have you ever noticed, you might have not, you may have, or maybe your kids, you feel like after they eat certain foods, they kind of sound nasal. I think they kind of flare up in their nose. And tomato is a big one for some of the kids I've seen. And milk is a big one. So basically anything that kind of cause an allergy in their system, nose is one of the first places that responds. Nothing that you're doing correctly. It's just that it's not detected early enough and corrected, right?
Breathing issues brought on by diet is kind of
absolutely. And mycobacterium. I mean, we're talking about the culture in their body. Where is that coming from? Do they have enough culture? Because what are we doing with our kids? We're raising them in sterile environments, right? So they don't have the good bacteria, or we're not exposing them to the good bacteria in their body. And what's in their gut is in the mouth. There's a connection right there. And
so what if it's too late? What if they're older children? What if it's already happened? What do we do now? What if you're an adult?
It's never too late. And do you do golf? Do you play golf?
I love it. I suck, but I love it.
At least the terminology. I don't want to talk. I think one of my really good friends, Dr. Hal Stewart, who's also another good airway dentist. I would like to get him on the call with you. He explained this in a really good way, and I'm gonna give him full credit for this analogy. But he's a great golfer too. I've done only twice, only to understand this analogy. The goal of golf is to get the ball into the hole.
That's all you got to do.
All you got to do.
Yeah.
Sometimes you're in the putting zone. I'm good at getting it from the putting zone. And I see these big boys just sitting there, just getting this ball and they're like, oh yeah, good putting. And I'm thinking, that doesn't seem too hard to me, but it is, right? Still, think of a putting zone as the final end point. You're just so close to it. You're just this close. You only have to work so hard to get the ball into the cup versus 600 yards from the green, right? Which one is harder? So you're going to need so many different tools to get the ball. Now, think of that ball end up in a sand box, whatever you guys call it. Don't quote me. I'm not a golfer. I've been only on the golf course. But that ball, if it ends up in the sand, you got to have a few other instruments to get it out of there.
Yeah.
And get it into the putting zone.
Yeah.
So when we're talking about a teenager or a 24-year-old that now is fully apneic on a CPAP machine at 600 yards from the green, versus a 2 weeks old baby that doesn't latch in a putting zone, which one is easier to get the ball to the cup? I'm going to bet if we can get that 6-month-old baby to breathe, to correct, we have a future of health and no problems, right? Versus, yes, we still can get that ball or the golf ball from 600 yards. It's going to be a lot more work. Not that it's impossible, especially for a good golfer like yourself, but it's a lot more work.
Got it.
Not me. I'm an attendant. It's very frustrating, but it can be done. However, the problem is When a ball is that far from the hole, you could imagine how many things can go wrong in between to achieve to that homeostasis. Again, think of the putting zone and the ball into the cup as the homeostasis. And the farther from the homeostasis our bodies are, the farther they have compensated, the more things can go wrong, the more sand holes that we're going to have to encounter before the ball gets even close to. It's not impossible. I believe a human body has a perfect capability of fixing itself if we stop intervening with medical procedures and give it the chance that it can function. Now, I'm not denying that medical system is required when we have a sick child, when we have someone who has diabetes already now, and they have already sleep apnea and they can die. Yes, we do need to manage that, right? But if we still, our end goal is to get the body back to homeostasis, we still got a great chance at it. I hate to find, and I'm treating a lot of younger folks in their 20s and their 30s that have upper airway resistance syndrome. It's basically that baby that was ignored, the sirens that went off, the kid that was mouth breathing ended up with a tiny mouth syndrome, and their teeth coming crooked. So what did the orthodontist do? The orthodontist took out more teeth. And this is my Melody. Melody can pitch in a couple of words. Say hi. So Melody actually is very educated about airway, right, Melody? And she can probably help run this webinar for me because she's my kid that was just snoring. And she actually says, if I tape my mouth at night, I'm going to wake up happy in the morning because she knows if Melody, can you please, mommy? And I still have those ADHD stuff going on. Okay, so that's my testimony. That's a kid that I cannot keep quiet, and we still are kind of trying to get her back into homeostasis. But my point is, if I can catch that child when they're at age 6 months old, when she was snoring and I took her to an ENT at 3 years old, if the ENT would have said, instead of saying just put Flonase in her nose, it's not going to help. Say, hey, let's just check her breathing. Let's just see how she's breathing. And she is tongue-tied. I could have had that released at age 3 and she would have bounced back. And all of those problems could have been eliminated, including the tonsillectomy, which to me is basically amputating a body part. There's a reason we have those tonsils. It's our line of defense. But when they're the only line of defense and they get enlarged, honey, I'm on a call, baby. When they are the only line of defense, we're just going to have to play with this. Then they get enlarged. And then yes, we have to remove them because again, remember, we're ignoring the sirens until there's a big fire. Now we have to put out the big fire. So why wait? Why wait to put out a fire? Well, we have all these other chances to blow away the smokes. Say hello, Melody, to everyone. And can you just please respect mommy's time here? Thank you. So she just wanted to introduce Lucy. I
think Lucy is fantastic.
I think Lucy's great.
Dr. Esmaili, I think we're coming to a close on this one pretty soon here.
I think, yes.
I'm going to have you back on, but if people want to learn more or figure out how to remedy the situation, or if they're just getting introduced, can they contact you, or do you have a resource where they can get more information, or what do they have to do in their own area to fix this?
You know, that's great. Yes, I'm very open to communicating with parents, with anyone out there. And soon enough, I'm going to have a YouTube channel. And I love the fact that we're doing more of this calls, and I would have a chance to expand and elaborate on some of the other topics that are the subtopics to the breathing. As you said, it's not a simple one. It is pretty simple, yet it is something that it's too much to take in at once.
That's
I'm
right.
open to, yes, I have, my website is peakviewdentistry.com, P with a Peter. And also I have a YouTube channel as well for for Peak View Dentistry. And I'm going to start being proactive about posting a lot more informational videos on there. I'm going to start a series of, hear this one, I'm going to start a series of breathing. And I'm going to have my children teaching other kids about breathing.
That's
great.
Breathing
habits, because
that's great.
Think, absolutely. And I want parents to tune in, ask questions, because there is not enough of us talking about this big epidemic. And I'm going to call it an epidemic to stop it right now. If you could just snap my finger and get all the children breathe by their nose by the age 1, can you imagine the amount of problems we can eradicate in the next 20 years? That will be my wish. And no wish. I don't believe any wish is big enough, but as a doctor and a mother again, I went through that with with my daughter. That is my passion, Matthew. And I'm so excited that you had me on the call. I enjoyed it. Definitely encourage anyone. If you want to reach out to me, my website is definitely a good route. And yeah, come on in and ask questions. And also my Facebook.
I can't wait to have you back on the show, Doctor. This was
Thank you.
eye-opening. It was educating and quite entertaining. So until next time, thank you very much.